Hello everybody, welcome back. It's been a while. Today we're going to go through the microbiology of the sexually transmitted pathogens. Unfortunately for us, STIs are on the rise, and it's going to be the disturbance of normal vaginal flora in women. And the infection signs would be abnormal discharge, unpleasant odors, suprapubic discomfort, dysuria, itching, burning, all of that. And these are the timelines of the STD symptoms. And usually they're within, 2 weeks, maybe a month. But there are the more problematic ones that can stay in the system for a long, long time. So bacterial vaginosis is usually caused by a variety of pathogens. The most common variable in all of them is Gardnerella vaginalis. So this will compete with the lactobacillus, which is normal flora, and disrupt the pH of the vagina. So they are gram variable, so a gram stain isn't going to help. And in general, they are rods, but they can be all sorts of rods, so they're pleomorphic. These are the other the pathogens that can cause vaginosis, but they're not in every single vaginosis case. The risk of getting an STI is, of course, unprotected sex, increased douching, and that is when you will insert, a douche in the vagina to clean. You shouldn't do that. The vagina actually is self-cleaning. That is the point of discharge, actually. That is a sign of a normal, healthy vagina. So, in vaginosis, the discharge is about grayish color. So normal, it can be white. A yeast infection, so this is candidiasis. This is going to be white and cloudy. The gray in particular is the vaginosis, and that can be distinguished from chlamydia, which is green, gonorrhea, which is generally yellow, and then pink and red, of course, and brown can, of course, mean cancer. So the complications is going to occur in pregnancy because vaginosis can transmit the bacteria to the child during birth, and it can cause, early delivery. Of course, the other complications would be the increased risk of a pelvic inflammatory disease. Oh, hello. All these are coming up. Sorry. So the pH of the vagina is going to be either increased or decreased. Normal vaginal pH is actually pretty low. There's a whiff test to determine vaginosis, which is when you add potassium hydroxide to discharge and then take a smell. Other clues would be clue cells. And in general, the first-line treatment is metronidazole. Unfortunately, the recurrence is very common, so it's a bit hard to treat. Sometimes you don't treat at all. You just let the disease run its course, or it's not a disease per se, it's infection. Let the infection run its course and try to take the preventative measures. So that would be consuming probiotics, having lactobacillus supplements. This is more extreme, having a vaginal capsule with boric acid, but cranberry juice actually is a very, very good deterrent of vaginosis. So the vulvovaginal diseases are generally caused by Candida albicans. And remember, we used that on a certain stain to differentiate it from all the other Candida species, and you use methylene blue to differentiate it. There is going to be an increased risk in patients who are diabetic and patients who are immunocompromised. Of course, that's for everything though, right? And on birth control. So when you see the vaginal walls through a speculum, there is going to be this cottage cheese growth, and it's going to itch really bad. So usually there's some like wounds, excoriation on the labia. Of course, remember, it's going to be a pseudohyphae. Germ tube test is going to be positive. You grow it on chrome agar, and as you can see here, Candida albicans is going to be kind of like greeny. Cruce is purple, and Tropicalis is going to be blue. And this is your clue cell where there's these pseudohyphae growing in. Okay, Trichomoniesis is going to be caused by Trichomonas vaginalis, and it's a flagellated heart-shaped protozoa. So this is the only protozoa of the bunch. Candida is a yeast. The vaginosis is caused by bacteria, like Gardnerella, and the disease is about the same, but the discharge, unlike vaginosis, is going to be foamy and green. Vaginosis, remember, is gray. There is something called a strawberry cervix, as you can see in this picture. They are all these dots. And that is going to be pretty pathognomonic for Trichomonas vaginalis, Trichomonas vaginalis. And there's like a little tail. They're flagellated, as you can see. Here's they say it's a heart-shaped. I'm not really sure if it looks like a heart, but that's what they say. And you detect it by the wet mount in warm saline to see them swim. But to be like confirmed, you do a PCR. When a whiff test is occur, it smells really bad. And you treat it with metronidazole. Urethritis can be in men and women. In general, this is more in men. So the discharge, it affects both, but it's easier to detect in men. But the discharge is generally purulent. The color of the discharge can be green or yellow, but there is dysuria and abnormal smelling urine, along with the itching, of course. Cervicitis is going to be, infection and inflammation of the cervix. And there's abnormal vaginal bleeding, especially after sex. So the cervix is very sensitive to touch. So even during a swab, it will bleed. PID is the most concerning disease of all the STIs because it can be all of the visceral organs in the pelvis. So this can include the endometrium, the ovarian tubes, and the ovaries themselves. And then the complications. The most problematic complication is the ectopic pregnancy and the infertility. So there's some just generalized symptoms at first. There's just like a fever, lower abdominal pain, and in women, tenderness at the cervix. So once it progresses, you see the vaginal discharge, the irregular bleeding, and then it becomes purulent. And then it progresses to nausea and vomiting. Neisseria gonorrhea is notorious for causing PID because it can invade. So Candida, the Trichomonas vaginalis, and the Gardnerella, they don't invade. They just stay on the outside of the body. These are just superficial infection. Neisseria gonorrhea is different. So it grows on special media, so thiamartin or New York City media. It's gram-negative diplococci, and it's shaped like a coffee bean. And it's oxidase and catalase positive. It's special because it only ferments glucose, so you can't grow it on McConkey. You can, but it's not going to change the color since it only ferments glucose, not lactose. The important virulence factors would be your pili. It's an IgA protease producer, and it produces LOS. And LOS is important because it triggers all of the inflammatory cytokines. It's a facultative intracellular pathogen, and the most problematic transmission is the neonatal transmission. So it can cause blindness in the neonates. So the IgA proteases avoid the mucosa immunity, and they have a lot of gene rearrangements, making it harder for our cells to recognize and target the pathogen. And using like antigen phase switching or phase variation, the pili and alpha protein can switch too, and repeat infection is very common due to all the switching and whatnot. This also makes it very, very difficult to make a vaccine. So they attach to the epithelial cells of all the mucal membranes, and that can be anywhere in the body. And it causes like a pretty strong inflammatory response. So purulent discharge is going to occur. In the urethra, there is very painful urination, and causes cervicitis, of course, and vulvovaginitis. In men, it can cause epididymitis, which can lead to sterility, and then PID, of course, the most problematic one, which can lead to ectopic pregnancy and infertility. And then it can also cause Fitzhugh-Curtis syndrome, which is where the liver is involved, and it causes these string signs, which are adhesions, to form in the peritoneum and the liver. So the signs would be severe pain, hepatic tenderness, and peritoneal inflammatory signs. So these are the other diseases. The ones that we need to be careful about is the Ophthalmia Neonatorum. So how do we treat that? Back in the day, they used like silver nitrate to drop into the eyes. But nowadays, I think they use like erythromycin for children. And of course, this can be disseminated. And the most important one is septic arthritis. So this is the most common cause of arthritis, or monoarticular arthritis, in young people. So if a patient comes in with generalized complaints, so like low fever, aches and pains and whatnot, but they complain of like pain in like one knee, not both knees, just one, then you should suspect gonorrhea, especially in males. Okay, so it's gram negative, and you use your Thayer Martin or your New York City medium, or you can use a chocolate agar along with 5% carbon dioxide. And then antigen detection is a more sensitive way to detect. But the medium is kind of important to see what the pathogen is sensitive to. So it's important because gonorrhea or Neisseria gonorrhea has a lot of resistance. So normal beta-lactams aren't going to work. Tetracycline resistance makes it problematic too. So you want to use a cephalosporin and even up to a carbapenem. But you have to be very careful, because once they gain resistance to these, there are very, very few drugs that are like as strong and as effective as these drugs. So these are like the top of your antibiotic ladder. You save them for last. So you add doxycycline and erythromycin because usually when gonorrhea is involved, there's a co-infection with chlamydia. So you want to treat the patients like prophylactically in pregnancy, and the FDA-approved drug is erythromycin. All right, on to Chlamydia Trachomatis. It's an obligate intracellular bacteria, unlike Neisseria gonorrhea, which is facultative. This one has a cell wall but doesn't have the muramic acid, and you can't stain it. So since it has to grow in the cell, there is really only one way you can culture it. It's tissue culture or like eggs, embryonic eggs. And usually like use chicken eggs or something. So they have an energy dependent because they can't make their own ATP, and a biphasic growth cycle. So remember, I think it was a while back, but there was like the elementary body and the reticulate bodies. So elementary bodies live in the wild, and then those are infectious, and then the reticulate bodies lie dormant in the cell until they mature and then come out. So they infect the non-ciliated columnar or the cuboidal epithelial cells of the mucous membrane, and they will form granuloma response, And unfortunately, they have a bunch of different serotypes, so those can cause different diseases, as you can see here. So we will cover it in a different lecture, but Trichomoniesis, this version, the genital disease is going to be caused by the serotypes D through K. Trachomas, caused by the serovariant A through C, is going to cause conjunctivitis. They turn the eyelashes inwards, cause these granuloma formation, and if not treated, leads to blindness. So the genital, once again, is caused by serotypes D through K. It's very common. It's the most common bacterial STI in the US. It affects men, it affects women, and it affects, unfortunately, infants. Blindness is a concern, but also the interstitial pneumonia. Other complications, it can lead to Reiter syndrome, which is mostly in HLA-B27 genotypes. And the Reiter syndrome is like urethritis, arthritis, and one more. I think it's conjunctivitis. There we go. So the diagnosis, you use the cell culture once again because it's an obligate intracellular organism. Gemcistein and basically immunological assays. You treat with doxycycline and azithromycin, and once again you give erythromycin for pregnant ladies. Mycoplasma is going to be the smallest free living organism, and they are urease positive, and the reservoir are in humans. So the disease is going to be basically a UTI. That is the most common one, but it can be associated with all these other diseases, PID, postpartum fever, etc., etc. But the most common one is the UTIs. So you culture it on A8 agar, and you treat with doxycycline. So on the A8 agar, it's going to show up as a fried egg. So that's it for now. Thank you for your attention and good luck studying.